Alright, on this video, I'm going to perform trach suction for my patient. Okay, so as always, you're going to look at the orders, verify that it's the right patient as always. Introduce yourself when you come to the patient room, tell them what you're going to perform. So for my patient, Mr. Jones, we'll do trach suction, okay? So before you do trach suction, you want to go ahead and have your suction ready. Your canister ready, your I can't recall what's it called, but that suction pump where you can do it from continuous, intermittent, we're gonna have it to continuous. Make sure you have tubes ready so we can hook up the trach suction tubing to the suction. We're gonna have some saline ready, so once we suction the patient, we can make sure our suction tube won't get clogged up. We're gonna have the patient in fallow position. Put on your PPE, you put on a face shield, because sometimes when you're doing suctioning, they'll cough and some of that sputum will get on you. So you put on a face shield if you want, don on some gloves, and go ahead and just get everything ready and situated. So patient Fowler's talking about it, got suction ready. And you already got your saline. Sometimes you want to kind of like halfway open it so it won't be a hard time when you open up your saline with your non-dominant hand, since it's going to be a sterile procedure. So besides that, we're just going to go ahead and tell them to take in some couple of deep breaths. I kind of want to get your O2 sats on up, or because when we're suctioning, their O2 might go down, because of course we're putting that suction tube down his trach. So we kind of want to do like a minute, or about a minute, just on taking deep breaths, 5-6 deep breaths. Or they're having that trach O2. I guess you kind of with that, just make sure that it's the same thing, taking deep breaths in, or kind of the flow increases some, so his O2 can rise up. And of course, make sure it's safe to do so. If his O2 is not in good range, of course you don't want to suction him, because that's going to decrease his O2. But anywho, we got all that situated. He's aware of it. So I got the right patient, identify him, look at his wristband, all that good stuff. Now let's go ahead and get the suction kit out. So as always, you'll remove your gloves, wash your hands, open the new kit. Get rid of that. We have this little box. Every kit is different, but go ahead and get that little box ready. That's where you put your saline at. And then here you're going to have your sterile gloves. Same thing. This is kind of like our sterile field. You got that 1-inch border. Okay. As long as you touch that 1-inch border and don't touch over it, you'll be fine. So as always, go ahead and get your gloves. These are actually my size. That's crazy. Let's see. There we are. All right, you got sterile gloves on. All right, let's open up the sterile field. Suction's ready. And so this is our sterile field. Okay, you can get rid of that. So I'm right-handed, so I'm going to mainly grab the tubing with my right hand. Okay. And then, so you do something like this, where you kind of grab this piece to it, and then, well, if you're non-dominant hand, which will be my left hand, I'll grab the suction tubing. That's why I just want non-dominant hand. But before I do all that, let me go ahead and, so I'm about to break the sterile field using my non-dominant hand. Open up my saline, and then I'm gonna pour that saline into that little box they gave us. Okay. So now I got some solution, I got some normal saline, some sterile saline in that container. Now I'm gonna grab that the suction and tubing with my trach suctioning You can see my right hand is sterile, my left hand is non-sterile. I'm going to connect those two. Okay, so now it's connected. Okay, so it's connected. So now I can use my my non-sterile hand, and I can just grab it from there. The only thing that can touch this tubing will be my sterile hand. So it's on continuous suction. Patient's on Fowler's. O2 looks good. He's aware we're about to do. This is kind of like where you'll do the intermittent suction. Once you hit that little hole right there, it will cause this to suction. So you already got your sterile saline in that box. You're gonna go straight in, and then you'll make sure it works by hitting that little hole and cause suction. And so it's gonna suction into the canister. So now we know that it does work. So from there, once you go down the patient's trach, you kind of go like in a kind of like a swirling. Well, you're gonna go straight down until the patient starts coughing, or until you feel some resistance, and then from there you're gonna come back slowly. No more than 10 seconds. You're gonna come back, but well, that's the max. You can't pass no more than 10 seconds. But you're gonna slowly come up and hit that suction. You never suction going in. You only suction coming out. So, like I said, get some of that sterile saline. It's working. It's good and ready to go. We go into the patient's trach. All right. We're gonna go in until he starts, until he'll feel some resistance or he starts coughing nonstop. You do want him to cough while during the whole process, so you can get some of that thick sputum out. But yeah, so you go in there. So all right, I got some resistance, or he's coughing heavily. So we're going to just start suctioning, and we're going to suction kind of like intermittent suction until it comes out. So you can't do no more than 10 seconds of this. All right, so we got that out the way. Tell him same thing. Give him some time to catch his breath, and you go back with the tube with that sterile saline suction. Make sure he gets all that sputum stuff out the line, because you don't want to clog it up. So it's been about a minute. He catches his breath. His O2 looks good. Now we go back in for the second time. And same thing. You don't suction going in. You only suction coming out. So you go in, 3, 2, 1. Cough. Try to breathe. Try to go nice and slow, but not too slow. And then when you're in there, feel some resistance, or he's coughing non-stop, you come back out slowly, kind of try to do like a swirling motion, and do like kind of like intermittent suction. Okay. All right, so I'm not gonna do no more than 2 times for this patient, but that's the main thing, is just trying to get all that out. Use the sterile saline, make sure your tubing doesn't get clogged up. From there, you can break sterile by removing everything you need to do, throwing all this away. If he has oxygen, put his oxygen back on. Listen to his lung sounds. Compare his respiratory rate before you started suctioning to after you suction him. His main thing is O2. Get a O2 probe, do it in his finger or his ear. Just make sure his oxygen is great. Make sure it's not below 90. But that's the main thing. Just make sure his O2 is not dropping, and make sure you just kind of do like focus on his lungs. But after that, of course, you'll get rid of everything. Remove your gloves, wash your hands, and of course, document. Like I said, if you had like O2, like one of them O2 traits or nasal cannula, whatever the case may be, kind of put that back on them. And then after that, all you gotta do is document his lung sounds, his respiratory rate, and then like the color of his secretions. And that's it for trach suctioning. All right.